All right, welcome back, everybody. Today's topic, um, I guess that they called it anaphylaxis. That would be kind of a cheap way to do it because this actually goes a lot deeper. But for what we need to know about it, we're going to talk about immunology and basically the reactions to proteins, which causes deleterious effects. And so, understand that immunology in itself is a huge, gigantic, incredible topic. But what do we need to know for the emergency setting? I think is kind of the key thing here. Number one, you got to read your book on this because there's some things in the book that you're going to need to make sure that you're at least familiar with the terms, especially when we go to talking about the different types of proteins and the different types of reactions. And it's one of the biggest things that I want to push about an allergic reaction. There is a difference between allergic reactions. You can have a mild allergic reaction, a moderate allergic reaction, and then true anaphylaxis, where you have shutdown of the breathing, a severe swelling of the airway. And by the way, there's 3 different ways to treat that. By the way, and I think and you have to know the difference between them. And you also have to understand that it can go from a simple rash to there's no airway left in a very short amount of time. So we need to understand that part of our immunization, our response to pathogens, and figure out how it is that we're supposed to treat these folks. Everybody that has an allergic reaction shouldn't get a load of epinephrine along with corticosteroids and getting a breathing treatment. Some of them just a little bit of Benadryl. Some of them just a little bit of oxygen, and you're fine. Okay, really, that's some of them are actually that simple. Okay, so anaphylaxis is the worst, the most severe type of allergic reaction. Okay, it's the difference between life and death. Identifying that, and by the way, if you identify that throat swelling, severe shutdown of the respiratory tracts because they all tighten up. Again, epinephrine is your drug of choice. Before Benadryl, even epinephrine. Again, epi, right? That's why they have epi pens and not Benadryl pens. Okay, so again, severe emergency reactions available. There are medicines that do that. Okay, EpiPens are quite common nowadays. Understand bee stings, wasp stings, 2 of the most common for fatal anaphylaxis. And actually, the way that works is kind of weird because you can get stung by a bee and nothing happens on the first shot, but you build up immunities to it, and then it has the reaction the second time you get stung. So again, I've been stung by a bee before, and it hasn't affected me like this. Again, at the same time, this can happen to one person on the first sting. Okay, I have an aunt that is severely allergic to ant bites. She gets bit by an ant, buddy. You better be hitting the EpiPen, or she's going to lock up on you. So again, we're going to talk about the principal body systems involved, response for combating the infection, and that's kind of the important. Matter of fact, that's kind of, we're going to go into it more when we get into the response to communicable diseases on that part. But again, a lot of, by the way, the COVID antibodies that we start producing is actually an immune response that is kind of not what it should be. And that's why it causes an increase in mast cell mucus production, which in turn, that mucus gets into the lungs and basically turns into concrete, where you can't get gas exchange, and why that disease process has been so horrible. Okay, so again, the cellular immunity is direct attack of foreign substances, the specialized cells for immune system. So again, the humoral immunity is the chemical attack by invading substances, and then the principal chemical agents of this attack are antibodies. Okay, and those are the Igs. And what I want you to know about the Igs, and we're going to get to it, and these are the 5 classes. I don't want you to learn each one. I want you to know, if you see IgA, D, E, G, or M, you know that is one of the classes of antibodies. And again, these are produced by B cells, okay? Again, your B cells are those are the ones that produce. The T cells are the ones that kind of identify. We talked a lot about T cells with the HIV, and how those cells identify what a pathogen is. And that's why HIV is so horrible, because it destroys the identifier. So therefore, the B cells don't actually send in the troops to start knocking out the infection. Okay, so an antigen, by the way, is any substance capable of inducing an immune response. That's a definition I would probably know. Again, most antigens, by the way, are proteins, but they can be other things. Viruses, prions, they can't parasitic. Actually, they can be that as well. Okay, and again, what they're responsible for, the antibodies, is to facilitate the removal of that substance from the body. Okay, that's what it's there to do. So when you're actually having that reaction, the allergic reaction, it's actually the body's attempt to try to get rid of whatever poison is in there. Okay. However, in certain cases, it kind of goes haywire, and we got to help people out with that. Okay, so by the way, several days the primary response is before cellular and humoral components of the immune system respond. And then the secondary response is antibodies specific to that type of antigen. Okay, and so matter of fact, if you did take the vaccines, that's what they actually booster, is the secondary response for that antigen specific. And that's any vaccine, by the way, whether it's the flu vaccine, if it's you're actually producing those secondary antibodies, so that when you are exposed to one of those antibodies, that you're able to combat it. So again, that's the natural immunity. Once you get it as a disease, again, chicken pox would be a good example. You get the chicken pox, you're not going to get it. You can get it again, but you already have antibodies made for the chicken pox, okay? And if you obtain this naturally, if you were a kid and got chicken pox, you itched for about 3 weeks, but guess what? You know what? You don't usually have to worry about chicken pox ever again. Shingles, whole nother story. Okay, but acquired immunity, as it develops over time, results from exposure to the antigen. When George Washington exposed his people to typhus at Valley Forge, or smallpox, I'm sorry. So he actually had his surgeons expose his troops. He lost nearly 10% of his troops by doing that. But when it came time, all of his guys were inoculated against the smallpox vaccine. And therefore, when the British got it, then, of course, it ran rampant through their troops. And again, his guys already exposed to it. Okay? So, again, natural acquired immunity is developed after birth. And again, it's new pathogens. And by the way, that's why breastfeeding actually is kind of important, because mom does pass antibodies through the breast milk into the child. Because again, the little ones aren't really born with that much naturally acquired immunity. So again, they have to develop their immune system. Okay, and then induced active immunity. This is designed to provide protection from exposure to the antigen at some point in the future. And again, most of this does actually happen naturally as well. Now, induced active immunity is it's achieved through vaccinations, and in a vaccination, the antigen is directly into the body. It actually depends on the vaccination. The newer vaccines actually transcribe RNA to essentially change the cell outlay. And yes, I know that sounds scary, but it actually is really safe. It has worked for years and years in the past, and a lot of people don't realize it. And if you want proof of that, insulin is made on that same principle. Okay, so we've only been taking insulin, I don't know, I've been taking it for 35 years. I think I'm okay. Okay, but the point is that these technologies have been around for a very long time. Development of antibodies specific to the antigen provides protection in the future. So again, building up that protection is what is very important. Now, most vaccines contain the antigen protein. A lot of your flu shots have the dead vaccine to it. Okay, I will tell you that right now. The DPT shot, by the way, yeah, it has actual dead virus so that you can build the antibodies, okay? And again, every now and then you do require a booster dose sometimes for that because the immunity level does go below a safe level. Now, so again, the key thing is that most of our vaccinations today do develop an active immunity. That's the good news, okay? But again, passive administration is the administration of antibodies to there, and let's not worry about those definitions. Let's talk about the allergies themselves. So sensitization, that's actually where you're exposed to the antigen, and then you get the immune response. Now, when we're dealing with this in an emergency situation, that's usually because there's a hypersensitivity to it, to that particular allergy, okay? To that whatever the allergen is, that there's some sort of exacerbated or exaggerated response, okay? So again, immediate hypersensitivity, that's the allergy, immediate reactions, hay fever, drug allergies, food allergies, eczema, asthma, all of these are direct, immediate hypersensitivity allergies. Now, yes, that's right. Especially your childhood asthma are actually immune response diseases. Okay. So again, allergen is caused by the release of the IgE antibody. So if you would want to remember one of those 5, probably this guy right here is the one that I would like to remember, okay? Again, these are the ones that usually cause us the most problem, and these are our number 1 culprits usually for doing it, okay? Shellfish is, and that's usually the iodine, by the way, in the shellfish. Peanuts, he's a big booger. Again, plant allergies, insect stings, all of these things can produce the allergen response, okay? So, okay, by the way, parenteral penicillin infections, those are kind of most common fatal anaphylactic reaction. Guys, anytime you give a medicine, the reason why we wait 20 minutes or somebody needs to observe them for 20 minutes, no matter what the medicine, is because of the chances of a hypersensitivity reaction. Okay, that's why we put them on the cardiac monitor. That's why we put them on the pulse ox, because if they're going to have this reaction, we can see it coming. Okay, it's very important that you do those things, especially when you administer any med, especially when it is a med that they don't normally take. And most of the time in emergency medicine, that is what we do. Okay, again, insect stings is the second most common. So again, it's the medication reactions is first, and usually the insect stings are second. And by the way, you can also develop a chronic reaction to this. And I'm going to give you the really good example, which is ACE inhibitors. Every now and then I unfortunately get this, but I've actually seen these reactions where their tongue swells to the point where they actually have to trach them. Okay. And I have had these reactions before too. The tongue gets big, the lips get big, the throat swells up. Again, I'm kind of knowledgeable about it. I had one the other day. As a matter of fact, my hand, this area of my hand right here, literally swole up. This is one of the reactions to the ACE inhibitors. So if you got somebody on a Pril, Acupril, Lisinopril, those are the ACE inhibitors, and I would probably ask them, hey, what are you taking that for? And have you ever had this happen before? And it usually happens over a long period of time of taking the medicine. And when it does happen, I usually have to get off of it for about 2 weeks and then resume my therapy course. But again, it's because I'm having a long-term hypersensitivity reaction to the medicine. All right. So again, the mast cells, by the way, the cells are the ones that are the boogers for us. They release histamine, heparin, and other substances. Well, histamine, what does that do? Causes the swelling. Heparin thins out the blood, okay? And it releases, it degranulates. And the reason is it's bringing more blood to wherever the pathogen is in an attempt to destroy it or get rid of it, okay? So again, these releases can be mild to severe, and that's the thing I want you to make sure. But histamine is a potent substance. It causes bronchoconstriction, but it increases intestinal motility. Again, it's trying to get rid of the pathogen. Some of the ways that it does it takes it to the digestive system and dumps it in there. That's right, you poo it out. Okay, but it also vasodilates an area. Now, if you do too much of that over too big of a space of time, ooh, wait a minute. Let's stop and think about some things that we get during an allergic reaction. I can't breathe. I'm swelling. We put more blood in that area, therefore the tissues, again, it releases, by the way, it releases fluid into that area as well, so therefore you get the swelling. Okay, vasodilation. I'm seeing the big blotches on the skin. Ooh, wow, amazing. Okay. Now, and by the way, nausea, sometimes diarrhea. Why? I'm trying to get rid of the poison. Okay. So all of these things do actually happen for a reason. Okay. Yeah. Benadryl doesn't go around saying, you know what? Yeah, you're probably going to poo over this. Well, newsflash, ladies and gentlemen. Yeah, you can. Okay. Now, principal body systems affected by anaphylaxis, again, cardiovascular, respiratory, and the gastrointestinal systems, and of course, your skin. All right. Skin signs tell all. I wonder if I've said that somewhere sometime. All right. So the biggest thing we got to watch out for is the anaphylaxis. So if there's a widespread histamine reaction, again, it's going to vasodilate you. What's that going to do? Your blood pressure down. Okay, there it goes. Okay. So again, that coupled with not being able to get oxygen in leads to much more dangerous situation, okay? And they actually die, guys, from the low blood pressure and circulatory shock. So how do we fix it? Okay, number one, antihistamines, right? Benadryl, epinephrine. Epinephrine causes what? Vasoconstriction, bronchodilation. Hey, it counteracts everything in an anaphylactic reaction. Wow. Amazing. Okay. So again, you got to look at where it is that how severe the reaction actually is when we're talking about this. Okay. Now, the bad thing about anaphylaxis is it usually hits 30 to 60 seconds. Okay. It can be delayed up to 15 to 20 minutes. But usually when anaphylaxis happens, this is when it's going to happen, 30 to 60 seconds in. Okay, so get your history, quick evaluation of the level of consciousness. And again, if you got laryngeal edema, again, that's going to be a airway nightmare. But again, your treatment, number one, Epi. Number two, Benadryl. Okay, so again, they're going to be breathing fast. And again, they're going to have bronchospasms. So what's another drug that we can use? Again, your Albuterol. Now, Atrovent, it can help. There's not a problem with doing it, but definitely the Albuterol can help. Being a beta agonist, it can cause bronchodilation, which is kind of what we want here in this situation. But so does your epinephrine, so just try to keep that in mind. Okay, the fine red rashes appear on the skin. That's the urticaria. These are the whelps and flares. Okay, and as the cardiovascular collapse continues, remember you're leaking fluid everywhere. The vessel permeability goes absolutely nuts during this time. The fluid starts to leak out of the pipes, okay? You're going to lose blood pressure because of that, because it's not just a localized area. In anaphylaxis, it's all over the place, okay? So again, these are the red whelps, the blotches. This would be the hives that you would see during an allergic reaction. Okay, and again, you're going to start, again, it starts increasing gastric motility, but unfortunately, it kind of tells the gastric tract to start wiping things out. Nausea, vomiting, diarrhea. If you ate something that you're poisonous to, it's going to say, nope, back up. Okay? And that's what you do. You end up throwing the stuff up. So again, it's actually doing what it's supposed to do, although it can cause some major complications for us, along with the bronchoconstriction and along with everything else. So, again, we put them on the pulse ox. We put them on the cardiac monitor. If they're intubated, of course, they get N-tidal. I think in an anaphylactic situation, N-tidal is going to tell you a lot more whether or not they're about to die on you. Okay, so again, I would put a capno cannula on them for sure. And again, you can get both respiratory and metabolic acidosis because of what is happening inside. Remember, you got a respiratory shutdown along with a metabolic shutdown. Okay, make sure you're seen safe. Now, as dumb as that sounds, I can tell you that I have been to a truck crash with the truck was carrying like 15 pods of bees. Yeah, that became a nightmare of a call. Okay. They usually only leave one stinger, the honeybees do. So again, make sure that you scrape off. This is something we learned in EMT school. Take your credit card, your name badge, scrape off the stinger, or use a scalpel, the backside of a scalpel blade to flick out these little dots that are in there. Get rid of the stingers, because the stingers can still have a sac on them and continue to pump in. So all that great work that you're doing by giving them Epi and Benadryl, you're fighting against the stinger still pumping in poison. Okay. And guys, don't forget about trauma. And again, they can be masked by the signs and symptoms of anaphylaxis as well. Okay, so again, how do we manage it? Okay, if it's simple, it's just the hives. There's no airway involvement. There's no wheezing. It's just you got blotchy skin, itching. Again, Benadryl, good choice. 25 to 50 milligrams usually. If you've got a moderate reaction, that's where you've got some breathing difficulty but no laryngeal edema. Might have some mild wheezing along with that. Again, bronchodilators, corticosteroids work really good there. Your Solumedrols, but give them Albuterol. Okay, again, when they're in anaphylaxis, guys, Epi, Benadryl in that order. Again, but you got to stop the histamine release, which is the Benadryl is your antihistamine. So you need to stop that as well. Give those two drugs as fast as you possibly can. Okay. Again, if we do have any trauma involved, yes, you can have trauma involved with the C-spine. O2 if the patient is hypoxic. If they are not breathing again, or the ventilations are inadequate, respiratory assistance, basic airway maneuvers, Epi and Benadryl, Epi and Benadryl. Again, remember, if you've got a swollen airway, guys, if you got a swollen airway, that's going to be probably a really difficult airway to actually take if you have to do that. So again, you got to remember that if you're going to be taking that airway, if you're thinking RSI this patient, number one, you probably don't need to do that. If the airway swelling is so severe, this is a good time to break out the scalpel, unfortunately. Okay. Again, be ready to do a surgical airway if the bag valve mask doesn't work. Okay. Because again, everything in the upper airway is probably going to be swollen. By the way, I would mark that spot early if I were you, because as it continues to swell, it's going to be a lot harder to find that. Make sure you get one IV, probably two, especially if you've got a lot of histamine release where you've got dilation of the blood vessels. It basically causes a distributive shock. And again, we can actually fix that. 2 liters of saline. And again, 6 hours later, they'll pay it all out. We're okay with that. All right. So again, the primary treatment for anaphylaxis, pharmacological. Epinephrine is your go-to drug. Antihistamines are your other ones. By the way, Phenergan is also an antihistamine, just to kind of throw that one out there. You might get a doc that goes, hey, we tried Benadryl, it didn't work. He says, well, you got any Phenergan? By the way, Zofran, not an antihistamine, so therefore it won't work as well. Now, your corticosteroids, again, these reduce inflammation. Just remember, it takes a little bit of time for these things to work, probably around 30 minutes before they start working. And then actually, if you're in a severe and prolonged anaphylactic reaction, guys, an Epi Drip or a dopamine drip might actually be needed. A Norepi Drip is also one of those. Remember, you got big blood vessels. Norepi will shrink them down for you. That is a definite. Okay. So actually, but I would say probably in the pre-hospital setting, I'm more of a use the epinephrines. The Epi Drip, usually 2 mics, titrated up to where you need it. Don't forget about your beta agonist, Ventolin, Proventil, Zopanex, any of these guys. They work really good, and it'll reverse the bronchospasms caused by the anaphylaxis, okay? Yes, you can use atropine. Yes, you can use glucagon. These are some agents that might be used. The glucagon helps reduce the histamine reaction. Vasopressin, again, is going to tighten down those vessels. So those are things that you can use. And remember that you need to let the patients know, especially when you're giving them epi, yeah, there are some bad side effects to giving epinephrine, right? Hey, you're going to feel like you're going to be panicked. You're going to feel like, your heart's going to start racing a little bit. That's okay. These are things that normally happen. Okay. And again, milder allergic reactions, they have milder symptoms and they usually have a normal mental status. Again, these guys, if they have dyspneas, we can give them supplemental oxygen, or if they're starting to wheeze, again, an albuterol treatment is not necessarily a bad thing here. And again, these are for the lesser ones. You can, lesser reactions, you can give Epi, IM, or sub-Q. So I got a lot of people ask me, which one's the better one. I think that if they're having active signs, IM is the way to go. I think that if they're having lesser signs, sub-Q, because again, it's a slower absorption and therefore the shock to the system's not as bad. That's my little guide for it. If you're in an emergency situation, we give it IM, okay? Or if we got the IV, then we would give it IV, okay? Now, remember, if we're giving epinephrine IV, I would probably weaken that dose out just a little bit, okay? Because again, and I would only do that if absolutely necessary. Again, younger patients, you can probably get away with it. Older patients, I'd be a little bit more worried about. Okay. If you've got a patient that you keep going back to allergic reactions to, probably a good time to educate them on, hey, you need an EpiPen and you need to go see your doctor, and make sure that you tell them that you need that. And make sure to wear your medic alert bracelet so we know that, hey, we don't need to play around with you. I'm allergic to bee stings. I got stung by a bee. Guess what? I need to, that's like the immediate thing to go to. And again, most of the folks there, they do have an EpiPen. As you are all EMTs, I'm not going to go through an EpiPen video because, simply putting it, it's really simple. You pull the cap off, you pull the safety cap off on the top, you jam it in their leg, you push the button, okay? And by the way, as a paramedic, you can still give these without any problem, okay? If it's the patient's own, you can give it, okay? Do it. Again, now for EMTs, we said, hey, you had to have, medical direction and all that. Newsflash, you have medical direction. It's called your standing orders. Get to it, okay? So again, they usually keep the paramedic often keeps a respiratory card for anaphylactic patients living in their service area. And again, it quickly identifies them, their allergy. So you can actually have this. Most of your CAD notes, by the way, you can put those in there. All right, so that's a little quick thing about immunology and the emergency that we're usually going to see with is an allergic reaction. Okay, so understand that, yes, we can gauge our treatment based on how bad the patient is, and you should, by the way. I think blasting somebody with you're hitting them with the shotgun effect when they've got just a little bit of a rash and swelling on their leg, I think that's a little bit of overkill. That's bad medicine, okay? So again, continue to monitor the patient. They can go from okay to bad in a short amount of time. All right, that's going to do it for today. You guys take care. I'll see you on the next one.